In this video, I'm going to show you how to get rid of a bout of dizziness or vertigo in 90 seconds or less. My name is Dr. John Saunders. I've been helping patients recover from spinal-related conditions for the last 22 years. In this video, I want to show you how you can avert an episode of dizziness or vertigo very quickly by using some specific acupressure points. I'm going to show you 3 acupressure points that can start to give you a relief in as little as 30 seconds. I want you to follow along with me so you can start to get relief immediately. The first acupressure point we're going to use is PC6. PC6 is easily found when you take your 3 fingers, drop them off your wrist. In the center, you're going to find a point between 2 tendons. We're going to put some pressure there. Now, this is very good to help calm the nervous system. It really helps with dizziness and vertigo. You want to find the spot, and you just want to either put sustained pressure there for 30 seconds. You could also do some circular massage, whatever you find more beneficial. A tip for here is start with a side that you feel, when you turn to that side, that's the possibility of causing your dizziness or vertigo. Start with that side, but definitely we want to balance things out and apply these acupressure points to both sides. You'll feel a little tender in the area that you find. That's probably the right spot, and that's where I'd start. And again, hold this for 30 seconds, either direct pressure or circular massage to start to notice the effects. The next acupressure point for dizziness vertigo is going to be GV20. This one's a little more tricky. You need to find the center point of the top of your head. So the easiest way to do that is take the top of the ear on both sides, come to the center and find a spot. So basically, we're going to take a line down the center, a line across the side, and find the spot on top of the head. You can use 2 fingers or 1 and the same thing. Apply some direct pressure to the point, or you can do some circular massage. If you're not sure, it might be best to get 2 fingers up there just so you cover a little bit more area. This point's really helpful for patients that suffer from headaches, anxiety, and of course, dizziness or vertigo of all types. Hold this for 30 seconds or so before moving on to the next point. This, you'll find, is quite tender, and that is a good indication that you are on the right spot. And finally, the last acupressure point, certainly not the least, however, is TE17. TE17 is in close proximity of the atlas, which is the C1 vertebrae, the most important bone in your spine. It is an area that's very sensitive. It has a lot of mechanoreceptors in that area, as well as the vagus nerve, there's blood flow, and it's just really good to bring some blood flow to that area to help support this. How you find it is, I'm going to get to my side here, you grab just underneath your ear, it's behind the ear, you're going to come in just in between, you're going to find a little bit of a gap between your jaw or mandible, and you're going to find this little spot that's very sensitive in that area. Again, if you're suffering from cervicogenic dizziness or BPPV, where you turn to the right and it affects it, start on that side. Same thing, a little bit of sustained pressure, or you can even do a circular movement in the area. One of my favorite spots, because it's very easy for you to find that sensitive area, and it can be done basically anywhere. You're going to sustain the pressure or the circular motion for about 30 seconds or so before moving on to the next side. So we're going to pull your ear up, come off the hard bone, and just right there, you're going to feel a little bit of spot right around that atlas or that lateral atlas. And oftentimes there's muscles here that are quite sensitive. That will be a good indication that you're on the right spot. The best time to use these points is when you're in an active bout of dizziness, vertigo, lightheadedness, or head fogginess. That is when I'd start. As well, in some people, you might find if you do this daily, 2 to 3 times daily, it helps prevent those episodes from occurring. And finally, if you still don't know the cause of your vertigo or dizziness, I suggest you see your healthcare provider to make sure you have the cause and there's nothing serious going on that will require more medical intervention. If you know you have BPPV or cervicogenic dizziness, then this video is going to be perfect for you to start right away. Please let me know in the comments which one you like the best and give you the most relief. And if you're new to my channel, maybe you'll consider subscribing so you can be informed when I upload new videos. And if you like videos like this, please show some support by giving me a thumbs up. If you know someone suffering, share this with them, as it might give them the relief that they're looking for as well. I appreciate you tuning in with me today. I can't wait to see my next video. Until then, stay well.